Self-Care Deficit or Self-Care Theory by Dorothea Orem. Dorothea Orem defined nursing as the art of assisting others to meet needs for self-care to maintain or improve human functioning effectively. Conceptual framework. Self-care. To take care for oneself. Self-care demands. Care activities needed to meet requirements needed for self-care. Self-care agency. Ability of a person to engage in self-care. There are conditioning factors that may influence the ability to engage. Nursing agency. If there is self-care deficit, nursing agency can compensate. Theory of self-care. The performance or practice of activities that individuals initiate and perform on their own behalf to maintain health and well-being.
The ability to engage in self-care is affected by basic conditioning factors.
This includes age, gender, development status, health status, sociocultural orientations, healthcare system factors, and pattern of living. The theory of self-care deficit is the central focus of Orem's general theory of nursing. It describes how people can be helped through nursing, and Orem's identifies 5 methods of helping. It describes how people can be helped through nursing: acting for and doing for others, guiding and directing, providing physical or psychological support, providing an environment promoting personal development, and teaching.
When there is self-care deficit, nursing is required. This describes how the patient's need will be met by the nurse, the patient, or both. The theory of Orem identifies 3 classifications of nursing system. This is to meet the self-care requisite of the patient. This includes the wholly compensatory system, partly compensatory system, and supportive educative system. First is the wholly compensatory system. This represents a situation in which the person is unable to carry out self-care action, requiring self-directed and controlled ambulation and manipulative movement or the medical prescription to refrain such activity. Persons with this limitation are socially dependent on others and their continued existence and well-being. These persons with coma, paralysis, vertebral fracture, and more may need most of the nursing agency.
Partly compensatory system. In the partly compensatory nursing system, the nurse and patient work together to meet patient's self-care needs. A patient can meet some self-care requisites but needs a nurse to help for others. The nurse compensates for what the client cannot do. The client is able to perform selected self-care activities but also accepts care performed by the nurse for needs the client is unable to meet independently. A patient has undergone an abdominal surgery. The nurse can assist the post-operative client to ambulate.
Yes.
Good morning, Mr. Smith. I'm Ishi and I will be your nurse for today. How are you feeling, sir?
I am doing fine.
That is nice to know. The doctor said you need to start walking, so I will be going to assist you to take a short walk down the hall. Is that okay with you?
Yes.
Okay then, so take my hand and slowly stand up as I walk you through down the hall.
Third classification of nursing system is the supportive educative system. Supportive educative system requires assistance in decision-making, behavior control, and acquisition of knowledge and skills to learn self-care. Although they are unable to do it alone, the person can perform and should learn to undertake required measures of outwardly or internally directed therapeutic self-care. This is one of their ways in order to help the patient achieve quality of life. Nurses can aid and care for their patients. They can also offer supportive educational care, guiding and educating patients about issues that are confusing to them.
A perfect example of this is educating a patient with diabetes before being discharged. We can hear how she instructed the patient on how to assist himself in order to manage his health adequately.
So I want to go over a couple of things that we're going to be working on today before you leave, and then I'm going to go over what's going to happen after you go home, okay? So before you leave, we're going to have you today give yourself those shots that you've been getting from the nurses, okay? So you know that they've been giving you insulin 4 times a day, right?
Right.
Right. So what you don't know is maybe what kind of insulin they've been giving you. So during the day, they've been giving you mealtime or short-acting insulin. Those are insulins that prevent those really big spikes in blood sugar after you eat a meal, okay? You get those before breakfast, lunch, and dinner. And that's what you've been getting over the last 24 to 48 hours, right?
Right.
Okay, perfect. And then you've been getting that long-acting insulin, or the Lantus, at night before you go to bed. You've probably been realizing, it's kind of weird they give me one before bed, but then they don't feed me anything, right? Okay. And the reason for that is those short-acting insulins, like I said, are supposed to prevent those spikes in your blood sugar after you eat a meal. But the one that you get at night is actually a long-acting insulin. It just secretes a little bit of insulin all day long for 24 hours. So we don't have to worry about when that's given in terms of having you eat a meal. Okay?
I'm glad.
Yes. All right. Well, it was a pleasure taking care of you.
Thank you, Doctor.
And I wish you well, and I'll see you in about 3 months.
This is our team. Thank you for watching at the very end. We would like to leave the quote of Mandy Hale. It's not selfish to love yourself, take care of yourself, and to make your happiness a priority. It's necessary.